the Ebola outbreak in Gulu. Let's not forget what happened on the morning of 7 October 2000, when our brother and son of 𝙁𝙊𝙇, a physician and a supervisor of St. Mary Hospital 𝙁𝙊𝙘 outside Gulu, Dr. Matthew Luquia, received a phone call informing him that mysterious illness killed two of the hospital student nurses. All of the victims were bleeding, vomiting blood. Luquia left home and he arrived that evening just to witness the death of a third nursing student. He then asked the head nurse to give him the chart of all unusual deaths in the past 2 weeks. He studied those charts and he identified cases with similar symptoms. And he went as far as reading all the reports from a US Center for Disease Control and Prevention. And he went to the World Health Organization on infectious disease that cause bleeding. He then suspected Ebola. In 1995, outbreak in Kikwit in Congo that killed a lot of people. And that is when they began to realize that probably it came through Congo when soldiers were dropped in the hospital, 𝙁𝙊𝙘 hospital, that caused a lot of death. Being a doctor, he informed his staff about his suspicions of the illness. The same group of local community leaders came to the hospital reporting that the entire families were dying in their villages. He then called the commissioner, Uganda Commissioner of Community Health, and reported the cases. And they dispatched a team from the Uganda Virus Research Institute to take blood samples. They came. They took blood samples. He moved very fast. When he knew that it was a mysterious disease, he started setting up isolation center isolation ward. And they suspected it was Ebola. When South Africa lab confirmed the Ebola outbreak, the World Health Organization delegation arrived in Gulu. They were surprised to find out how Dr. Matthew 𝙏𝙗𝙖𝙪 efficiently managed the operation. But the crisis in Gulu continued to worsen. By the third week of October, the number of victims increased to almost 60. He ordered his nurses to assist the patients. And he did lead by example, as an example of a real doctor who was hurt for his people. He knew what he was up to, but he managed to keep his staff motivated. That is what we really call leading by example. He did it. And we have to remember that he is a hero. And it is difficult to forget what happened in 2000. We have to keep it in our mind. We have to understand that he offered his life. He paid with his life to save us, the people of 𝙁𝙊𝙇. And we have to make sure that his legacy is protected. We have to make sure that nothing like this happen again when sickness are imported from one country to another, or they are sent to the hospital with a different intention. We cannot accept that to happen. As I said, he worked so hard. The hospital workers also began falling sick. 12 more died from 𝙁𝙗𝙗 Hospital. At the funeral of an Italian doctor, an Italian nurse who gave her life to save our people. But still, the man never gave up. He rallied up his workers, his nurses, and he told them, we cannot stop. We have to go on. It is our duty to help the people. And the morale of the workers were high, even though they knew that the job they were doing was risky. But they continued with the work of trying to save life. They did their job. He saved our people's life. and that we should really be grateful for. So they all agreed among themselves, said we are going to work, we are going to save life. In other cases, people thought it was malaria killing people. But then they said, no, we think it is Ebola, and it was confirmed really that it was Ebola killing the people. Let's not forget what Dr. Matthew 𝙏𝙗𝙧 died for. Let's not take the present coronavirus lightly. We could then be heading for another serious death in 𝙁𝙊𝙇. I'd been hearing a lot on conversation in the social media. We have a lot of people in 𝙁𝙊𝙇 who want to become specialists in the field of coronavirus. When you hear them talking, you may think that they are doctors or senior advisors in the field of infectious diseases. That is why I try to remember our brother, Dr. Martin 𝙏𝙗𝙧, that he is the real doctor. And we have to be very careful what we wish for. We have to remember the losses we had, the pain we went through, the people we lost. And I had been hearing an interview in the social media, in a radio routine, that Gulu University Faculty of Medicine claim that they have a plan to test and manage COVID-19 patients. The faculty dean, Dr. 𝙁𝙗𝙧 Felix, told reporters that the university has a $4.5 million multifunction bioscience laboratory commissioned in January 2020. Already has some of the equipment and only need additional support to secure laboratory reagents and protective materials. 𝙁𝙗𝙧 is also the husband of a state minister of health. He said the laboratory has the capacity of testing 1,000 samples daily, an opportunity that should not be wasted. They just need 2.5 billion Ugandan shilling to put the plan in action. I do agree, Mr. 𝙁𝙗𝙧. This is a very ambitious plan, but let's think twice and make sure, first of all, that all loopholes are covered. You see, these people doing the business of testing and looking for medicine around the world today, they work on the basis that when you start just test, you have to have a steady income. I don't believe that the $2.5 billion Uganda shillings you're talking about is enough to safeguard that laboratory. Let's not rush. Think twice. Remember what happened in 2000? How the brave man, Dr. Matthew Lukwia, worked hard to save his people. You should also work hard to save our people. But don't start something that can turn around and haunt us for the rest of our life. Thank you for listening, and don't forget to subscribe. I will be back.